Good evening. Welcome to another ASI webinar. This will be the last for some time because we're taking a break off for the month of August. But we're very lucky tonight to have a most distinguished guest, Dr. Lawrence Girlis. He has done many things, including an épée fencing champion, and holds the Army Proficiency Certificate. So think carefully before you cross swords with him. He qualified at Cambridge and was a Price Scholar at the Royal London Hospital. He worked on interferon for Biogen at Geneva in Switzerland. As medical director of Novo in the UK, he was responsible for the first ever worldwide approval of human insulin for use in patients. He was a visiting specialist in diabetes in the Falkland Islands. He is also a media doctor working for LBC, BBC and Talk Radio. He is a specialist in diabetes and biotechnology. He is CEO of Same Day Doctor Holdings, which he formed in 2003, and is a founder and medical advisor to the charity, the Independent Diabetes Trust. He's also an advisor to the National Theatre and other London theatres. Dr. Girlis, it's a real privilege to have you join us today. Okay.
Can you hear me now?
I can hear you now, yes, good.
Okay, thank you. Thank you for inviting me. I'm looking forward to this.
Excellent. Well, look, could you start by giving our audience an outline of your own career in health and medicine?
Yeah. Well, you summarized essentially the highlights of my CV. In terms of my career, I worked in hospital medicine for a few years and as an NHS GP thereafter before going into the pharmaceutical industry. I've now been in full-time private practice for a number of years. So I have no NHS connection, apart from the rather bizarre fact that I have an appraisal each year in the NHS because I'm a GMC responsible officer. So I still get some insight into the NHS. The doctors who work for us all work part-time in the NHS, so I still have quite a good handle on what goes on, both some of them in hospitals, some of them in NHS general practice. So I try to keep my finger on the pulse of what's going on, both in private practice and the NHS.
Okay. Do you think the NHS changed since you were involved in it full time? And if it has, what do you think is behind the changes that have occurred?
Well, in every way, it's got worse. It's an overloaded, overcrowded, failing system. It's been failing for a long time. A rather simplistic analogy I've mentioned before is that it's like a car that's broken. The engine's still running, so it's moving forward, but there's a flat tire. The exhaust is falling off. The big end on the engine has gone, making a lot of noise. But as long as it's still running, people will still think it's doing something, even though it's costing £212 billion per year. I think the worst part for me has been starting with the 2012 Olympics and the sanctification of the NHS as a cult, followed by recently the clapping on doorstep. And I regard that as sinister in a number of ways. It has a number of effects. First of all, it elevates the staff in the NHS to quasi-hero status, which actually...
Priesthood.
Yeah, which actually gives them a sort of arrogance. I'm not sure arrogance is quite the word I'm looking for. Maybe some of the participants help me. But there's a sense of moral superiority that doctors working in the NHS have over their patients, certainly, and also when they compare themselves with private medicine, because medicine, as I may get time to explain later, is hugely tribal. GPs versus hospitals, physicians versus surgeons, NHS versus private, and it's actually beset with problems because of its tribalism. The other aspect of the elevating doctors and nurses and other staff to the priesthood is that people aren't allowed to criticize the NHS because it's held in as a god. It feels not correct to elevate it. One major change in the time when the BMA used to be a sort of middle of the road, perhaps a few stuffy old men, and I've seen the union, which I left, become essentially a very, very left-leaning organization. I still read the BMJ every week and I spend most of my time shouting at it. There's still a bit of science in it, which is the reason I read it, but the politics in the BMJ has moved sharply to the left. And you see this when you talk to healthcare workers. It's a bit like the teachers that we've seen recently during the pandemic, that attitudes, opinions coming out of the NHS tend to reflect very much left-leaning ideas. And I've actually been disappointed that the doctors, nurses cannot separate themselves from that aspect of feeling that must be their position in order to, as they see it, protect the NHS.
Okay, let's get on to the pandemic. How well do you think the NHS handled it? Were there things it might have done better and sooner? And were there things that might have been better had they not been done at all?
I've been, as you can hear, critical so far. I think it's a bit unfair. I think the pandemic is, a once in 100 years situation. I don't think anyone could have overall handled it much better. You look at other countries, people have said, oh, look at Germany, look at Sweden, look at Australia, look at the USA. All of those countries have had their failings. With the benefit of hindsight, yes, PPE was a bit of a mess. The care homes were handled badly. Testing came in too late. In the early days, a lot of older people were being certified as dead from COVID when they hadn't even been tested. Back in March 2020, we couldn't even test people. There weren't enough tests available. Now we're testing too many people. And I'm pleased to say one of the reasons for the recent decline in so-called cases, i.e. positive tests, is that we've reduced mass testing, largely because the schools have closed. And I think, as I say, you can criticize government, you can criticize health service, but they've been lurching from crisis to crisis. And I think overall, particularly with the success of the vaccination campaign, we've not done too badly. I wouldn't be overtly critical. Certainly we should have done things differently. I've never been a great fan of mass lockdowns or mass testing, but we can come on to that.
So some people accuse the government of sheltering behind scientists instead of, taking political decisions and setting a lead themselves, even when a significant part of the science seemed self-contradictory. You pick a different scientist, you get a different view. Do you think there's a case for taking the view that the government was sheltering too far behind the white coats of scientists?
I've thought a lot about that, and I think they are hiding to nothing. I think there will be a public inquiry. I think if a politician decided to go against the direct advice of the scientist, bear in mind how many people have died during this pandemic, I think that would be a dangerous thing to do. I think the government have tried hard to oppose the scientists, but the scientists have taken, in my view, an extreme view, and we've seen this recently, with many senior scientists predicting that the cases will go up to 100,000 or 200,000 per day. That's not happened. There has been a lot of doom mongering from scientists, and I feel the politicians have been trapped. Again, I would love to blame them, but I think they have tried. We know that the leadership of the Conservative Party are libertarian, and I think they have tried to break away from the grip of the scientists, but I think they're trapped by the strength of feeling.
Sure, you've done more about taking collateral damage into account. We prioritised only COVID cases within the NHS, and so in many cases, people suffering from cancer or heart conditions had their treatment either denied or delayed, and that caused more deaths than would have happened otherwise. Did we take sufficient account of the collateral effect?
No, and I was one of the signatories to the letter to the Health Secretary and the Great Barrington Declaration, which said exactly that. And really right from the start, everyone's become so COVID obsessed that patients have been neglected. And I've seen firsthand patients whose cancer treatment was delayed with devastating effect. And at a more prosaic level, I've seen people with simple things turned away from GP surgeries because GPs, some of them decided virtually to shut up shop. Others provided a patchy service. It's been mixed. So overall, I think that the health service, not the government, the health service has interpreted the guidelines in such a way that's done great damage to a lot of patients. Yes, the collateral damage has been huge. Mental health, we've seen increase in suicides, we've seen increase in deaths from alcoholic liver disease, and so on and so on. And cancer specialists tell me that they're seeing patients now who should have presented months ago, and that, of course, will have a devastating effect on their prognosis.
The government took over private hospital beds almost straight away for NHS COVID treatment.
Yeah.
Do you think they were right to do it on the scale they did?
They didn't know. Of course, they didn't use them. I don't know if you know, we couldn't refer anyone into private hospitals for months because all the beds had been sequestered by the health service, but they were never used.
They were empty beds.
Empty beds, yeah. And surgeons standing around doing nothing, absolutely. Because private practice ground to a halt anyway, to a large extent. As you could see with the Nightingale hospitals, they were barely used. So the private hospitals literally had empty beds that were being paid for. Huge contracts from government to the private hospital suppliers, they were never used. And I think it was a rather ham-fisted attempt to use whatever resources are available. We didn't know how bad the pandemic would be. I think they kind of rushed into that, but you could say they rushed into ordering vaccines too soon. And in a sense, that rush worked out, but the rush to buy a hospital beds didn't.
But the rush to vaccines paid off, didn't it? Handsomely. And that's
Exactly.
If they did one thing absolutely right, that was it. And it wasn't done by the NHS, was it? You brought in someone.
Yes, but decisions were made by government to put money to order vaccines that had, bear in mind, not even been licensed, that were still in an early stage. We didn't know. It's just fortunate that two of the early vaccines, the Oxford AstraZeneca and the Pfizer, turned out to be good vaccines. There have been a number of vaccines that have fallen by the wayside in research, either because of adverse events or because they simply weren't effective enough. So there was a lot of good fortune, and they bet their money. When you place an order with a vaccine manufacturer, you sign a contract, you commit yourself to certain financial obligations, and then you hope the vaccine is going to come right and work and be available in quantities. So there was a huge gamble, and an expensive gamble. We blame government for spending money on PPE and as I've just done on the sequestering beds, but actually they got it right with the vaccines. But it was a gamble.
Mm-hmm. You've worked in both public and private sectors. What would you say are the strengths and weaknesses of each of them?
Well, actually, let me start by criticising the private sector, which may surprise you. It's still very much seen as a way for specialists to earn extra money. It doesn't, in my view, provide a comprehensive enough service. So I went to a new private facility recently, absolutely spanking brand new, American style. And one of my first questions is, what are your opening hours? Well, they're open Monday to Friday. I'm going to bang my own drum. Same Day Doctor is open 7 days a week. It's something I wanted to do a long time ago. And we have people looking at emails from 6 in the morning till 10 at night and answering them and dealing with them. And that's what people need. The private sector is very, very poor at that. I find if I have a favorite specialist and they've gone on holiday, their PA doesn't suggest where I can go to. For many years, it was very difficult getting patients into private hospitals. You had to phone around, find a specialist, get the insurance approval. I said to the London Clinic many years ago, you should have a private casualty department. And they kind of laughed at me, because they could see the complications of getting insurance approved and so on. Now, over the last few years, a number of private hospitals, Princess Grace and others, have urgent care centres, which are open 7 days a week up till 10 p.m. So there's been a slight move in that direction. But the private sector still doesn't provide a good enough comprehensive service. And I've seen examples recently where patients had operations, they've got complications, they can't even get hold of the surgeon, and they've gone into the NHS. And understandably, NHS doctors, although they're obliged to treat those people, they get a bit frustrated that they have to pick up the pieces of the private sector, particularly on the surgical side. Having said that, I think the private sector is good quality, not just because people pay for it. I think the level of service, the level of care is absolutely first class in this country. I have open access to full scanning facilities, blood tests, and so on. And I've got access to a lot of specialists, many of whom I now know. I can phone people up, and if they're around, get someone seen very quickly. And we can move very, very quickly and save lives in that way. The health service, it's too big. Any large organization, I've worked for pharmaceutical companies, any large organization is dysfunctional. The health service is dysfunctional at every level. It's over, there's too many layers of management, too much regulation, too much paperwork, too much administration, and absolutely zero motivation from the staff to provide a good service. And I refer to the moral superiority stroke arrogance, and this comes across to the patients all the time. Patients being told by whether it's receptionists in general practice or by snooty administration or nurses or even doctors in A&E departments that what they have is not important, or we're not going to help you, or go back to your GP because we can't help you. That is happening all the time. Every day patients are being dismissed, upset, because there's zero adherence to any form of customer service. And the public are customers. They're paying for the health service. They're paying over £200 billion a year, but they appear to have very little in the way of consumer rights when faced in a healthcare setting. And that percolates all the way through. If you give the doctors and the hospitals and the general practices moral superiority, they don't have to do anything. They're getting paid. GPs are paid just for the number of patients on their list, not for how much work they do, which is why many of them have quite enjoyed shutting up shop, not seeing patients face to face, and not providing any level of service while the money comes in. And I find that incredibly frustrating. I don't think doctors should just be motivated by money. And we do see in some health systems that doctors can be very greedy if they're on an item of service basis. But I think the way the health service presents, there's no motivation whatsoever to provide any level of, as I say, customer satisfaction.
But you see, how do you think the NHS compares with health in other
countries?
Other lessons we could learn from the way other countries do it?
Absolutely, yes. And I don't want to start talking about America because that's dysfunctional and very bad and very different. And people often see this problem as a binary one. We can either have what we've got here or we go to the American model. That's clearly not the case. There are other alternatives. Particularly, I find Australian patients come to the UK and they have such a good level of care in their country. I think it's a mixture of an insurance base with co-payment. So patients pay a little bit for everything, but they have insurance or the government picks up the majority. The French system is similar. German system is an insurance-based system. And we need to look at those countries and see how they've done it, rather than think that the NHS is going to be sold to the Americans, which is something that came up at the last election. Yes, and we do need to learn. We need to look at it. And I sometimes remember when Tony Blair won his big majority, even he was looking at perhaps introducing user fees. And Lord Winston, famously, a Labour peer, said we've got to move to an insurance-based system. That was many years ago. The problem is that politically, I speak to politicians. I'm not political myself. I'm not a member of a political party. But the politicians I speak to know that you just cannot touch the sacred cow that's a health service. You can't even begin to tamper around the edges with it because it would be political suicide. And the politicians know that. They absolutely know that.
So there's no change you don't. Everyone says it's not going to be the same post. But if you were to propose some significant changes to it, do you think these would be impossible to do?
The short answer to that, Madsen, is yes. I think it would be impossible. I mean, even if there were political will, there's also the social contract. I don't think people in this country, having had so many years of the health service, and people say to me, when they come to me and they have to pay for private care, they say to me, oh, but the NHS is free. I say to them, no, it isn't free. It's not free at all. People have had so many years of free healthcare, they're trying to do anything to it now. Even, even for middle-class people that might be able to afford to pay a little bit, it would be very difficult to do. I had an idea a few years ago that what you do is you do it gradually. You start with an education program. What I would have done, for example, instead of a £9 per item prescription charge, And bear in mind that 90% of prescriptions in the UK are dispensed free of charge because of widespread fraud. I would reduce the prescription charge to a nominal level, but take away all the exemptions. And that would at least begin to educate people that health care is something you have to pay for. And they'd actually be getting something physical in their hand for it. And that's never going to happen. When the prescription charge was 50 pence per item, half the prescriptions were paid for. As the prescription charge has gone up, the number of people claiming exemption has gone up. And that gives you some measure of the mentality of the general public. And I sometimes say to in this situation, when I'm explaining this, if the politicians know they can't touch the health service, then in a sense, the public have voted for the health service as it exists at the moment. They've voted for a substandard service, because anything that you try to do to improve it that involves any form of control on demand, whether that's by user fees or anything else, the public would be in uproar. And so in a sense, I do blame the public, because the politicians might have tried if the atmosphere had been different. So the short answer to your question, can it change? I doubt it very much. I really do. And, you know, you look at countries like Germany and France, and I believe they have a flatter class structure, and I think we have quite a diverse class system in this country. I think it'd be very hard to say to people, well, here's an insurance system. I've often had people think national insurance is actually an insurance system. I mean, it's called national insurance. A lot of people think that is an insurance system that goes to the health service. Of course, the money doesn't, it goes straight into HMRC's pocket. I've had foreign people come over and they say, oh, well, I pay national insurance. Can I come to see a private doctor? And I say, you can come in, but you're still going to have to pay. So we would need a massive education program, and we would need someone to take it by the scruff of the neck. I would like actually the change to come from the public themselves rather than the politicians, but because I think that might work if the public get fed up enough, then that can happen.
It would have to be done in the first year of a new parliament, probably in the first few months. So it would have time to bed in before, get the storm over with before the next election.
Yeah, well, I sometimes say a Labour government could do it, because a Conservative government will be blamed forever. But as I said, Tony Blair was thinking about it. I knew Tony Blair. We swapped houses with him and Cherie in Islington, and I've actually voted for him. And he did want to look at it, but very soon he realised it just couldn't be done. But a Labour government with a big majority at that time might have been able to do something. I think things have moved on. We've got too many culture wars, and with the availability of social media now, I think such changes would be very, very hard to bring in.
Now, we've got a question. I'm going to take the first question now from Eamon Butler, who has considerable clout within this organisation since he's one of its directors. Yeah. And he asks, he says, shops, supermarkets, restaurants and hotels quickly worked out ways of providing service safely. He asks, did NHS and GPs respond equally creatively? Yeah. Or was COVID used as an excuse to avoid putting in the service and effort?
Certainly. I mean, it was patchy. I do know some GPs who tried to stay open. We carried on seeing face-to-face people, but the NHS GPs, a lot of them just hid behind COVID and shut up shop. Bear in mind that pressure may have come from reception staff. We've found that our admin staff have been more frightened about catching COVID from patients than actually the clinicians have. But yes, I think that there was no motivation for the GPs to do anything. They just said, you know, you can have a remote consultation if you're lucky, and those are quite difficult to get. Otherwise, you can't come in. And I think that was a disgraceful behaviour. I think the patients were let down. We've seen numerous complaints. I speak to people in the media who collect numerous complaints about not being able to access GPs. So yeah, I think that's right. I think that's so. Eamon's also mentioned the point about, you know, would some sort of localized decision making be helpful? It's something I've been wanting to do for a long time, but I think that's very difficult because, you know, you'd end up, for example, with doctors and nurses in London being paid more than other parts of the country and so on. And that goes against the ethos of what so many people believe in. But yes, I think decentralizing the health service would be one approach. But the people that run the health service are addicted to central control. I think that too would be very difficult to bring in.
One of the questions, first to remain anonymous, said, would you classify yourself as a COVID denier?
Absolutely.
Obviously, yeah.
Absolutely not. I mean, on the contrary, I've had COVID. It's a nasty virus. I tell everyone to go out and get the vaccines. I think at the moment, I'm seeing cases firsthand of people that have refused to have the vaccine, and some young people very ill. I heard a story today. The boyfriend of someone that works in one of our clinics is, very ill indeed, and he's a young person. No, COVID's a nasty, nasty virus, but we do have over 90% immunity levels in this country. We are winning the battle. The vaccination program has been good, and by and large, young people don't do as badly as the elderly. But no, COVID is very real, as I know from personal experience.
Yeah, we've got a comment here from Mike Cross, who he says that the pharma-driven worldwide medicine is an unmitigated disaster. So that's in the NHS, in the USA, rather. Medical negligence or malpractice is the third largest cause of death, and the nation's life expectancy is on the decline, while addictions to pharmaceuticals is rising. And he wonders what might be done on a worldwide healthcare basis to so to speak, start educating the public and the practitioners as to what healthcare should be all about.
Yeah, the pharmaceutical industry is one of these easy targets and largely misunderstood. I know, having worked on both sides, that the pharmacy, if you look at the Oxford AstraZeneca vaccine, the Pfizer vaccine, those have come from private industry. And if you look at the number of breakthrough drugs over the years that have come out of university or academic research, it's tiny compared with those. Most of the major breakthroughs in therapeutics, statins for blood pressure, H2 receptors and proton pump inhibitors for the stomach, beta blockers, drugs for hypertension, have all come from pharmaceutical research. So it's too much of an easy target to blame the pharmaceutical companies. And it's not something I accept. All governments control their spending on pharmaceuticals and the pricing. They don't license everything. The pharmaceutical companies can't force doctors to prescribe things, and we do a lot of generic prescribing. I personally don't prescribe anything of great expense because my patients have to pay the full price at the pharmacy. So I can manage most medical conditions with cheap generic drugs, and most GPs do that as well. The major breakthroughs that we're seeing in other diseases, the new drugs are expensive. So no, I won't accept that. In terms of educating people, people love taking medicines, it's part of the human condition. There was a famous clinician some years ago who said what separates humans from animals is their desire to take medication. So there's a huge need for people to have access to medication. I'm getting emails every day now, as I have done for the last year, asking for the vaccine. It's not available other than on the NHS, which I'm pleased. I think that's a right decision. I don't think people should be queue jumping. Yes, education programs would help.
It looks as though COVID isn't going to go away. I mean, people who say, wait until it's all, it's not going to. Can we learn to live with like we do with flu?
I'm a little more optimistic. I think we are seeing the virus mutate. We have got good levels of immunity. I would like to think that once more and more people are vaccinated, that the virus will lose the number of hosts. Now, women and children and teenagers may not be vaccinated, but we're going to see a bit of COVID for a while. I'd still like to think, as with swine flu and SARS, that the virus might disappear. So I've always been optimistic, and I think we're doing particularly well at the moment, with a few exceptions. I think we're doing particularly well.
You've been vaccinated?
I've been vaccinated, absolutely. I tell my patients
I've
I've been
had,
vaccinated. Even though I had COVID, I still went out and had my 2 Pfizer vaccines. I've measured my antibody levels. They're sky high. They're very high. I believe that immunity will last a long time. I'm not sure whether there'll be a need for a booster vaccine, but certainly having had COVID, that gives me very good immunity. But I've had the vaccines as well.
Everyone Smith has had their jabs, including me. And my assumption is when I go along in the autumn for my annual flu jab, I'll be offered probably an annual COVID jab at about the same time. Is that a likely prospect?
I think there's a real possibility of that. And I think that given if you had no side effects, it probably is a good thing. There's some evidence that the immunity from vaccination is not lifelong. We don't know that. Very, very, very few people have had COVID twice. Some people, as we know recently, have had COVID even though they've had 2 vaccinations. So I think a booster vaccine probably is a good idea.
There's attitudes have changed in Britain. Is there a case for that? Many people in the UK have lost what we would always have called a healthy skepticism of government and politicians that used to characterise them, and they've actually got to be bossed about. Do you think there's a case in
that? I think what's happened over the last 18 months, that where politicians have enjoyed the power of telling us how to live their lives, and worse than that, they've manipulated information in a way to change behaviour. So by always telling us worst case scenarios and frightening us, I mean, there has been a Project Fear. This has been a deliberate plan to frighten people into, not going out as much and staying at home and being careful. And I'm not sure that this was the right approach. And I think that it's created, we've got enough culture wars. We've got anti-vaxxers, pro-vaxxers, anti-maskers, pro-maskers, vaccine passports now the latest culture war. And, having had years of this with Brexit and Remain, I think governments have just fueled these culture wars even more. And I just wish that the scientists and the politicians had been more honest with us and allowed us to make our own decisions rather than to try to scare us into this abnormal behaviour.
Yeah, we got a question here from Lindsay Jenkins, who points out that Mrs. Thatcher enabled dentists and opticians to be partly off. What if the way in which, some parts of the NHS could be treated in the same way and begin to break up the behemoth, the gigantic overreaching organisation?
I think that's doable. And I often look at what the dentists see. The thing is, a dentist can do NHS and private work in the same premises, and they can say to their NHS patient, I can't do that root canal work on the NHS, but I can do it privately. And actually the dentists enabled, took a lot of NHS dentistry away from the NHS and moved into their private practice, possibly for selfish reasons. But then my understanding is that they're paid very poorly on the NHS. NHS GPs cannot do that. An NHS GP cannot take fees from patients on their list. And that is a huge barrier to doing that. We have a 2-tier system anyway, but as soon as you start to try to free up parts of general practice or even hospital medicine away from the NHS, you're going to be accused that we have a 2-tier system. But I actually think that would be one approach. Let's say to those people who do want to pay for it, apart from what they do now, that here is an alternative system that's nationwide. It's not patchy. I mean, there are some parts of the country have very little private practice. A nationwide way that the people who choose to pay can save the health service money and come out and pay for themselves and get alternative treatment. But again, I can't see that you can sell that politically without people accusing you of another culture war, 2-tierism, one rule for them, another for us, and the rich and the poor, and so on.
Yeah, Eamon Butler suggests that another way might be to take the NHS down more to a more local, so that local areas will have more decision-making powers, and therefore that again will break up the the giant overreaching national monster with its bureaucracy. Is there a case for that?
Yes, and certainly if you look at the German system, albeit an insurance-based system, that one of the successes of the German system is that it's very much locally controlled. That would be a possibility. It would be probably chaotic to start with, but probably to give local budgets, local incentives, local pay rates and so on might work, and it might break up the behemoth as it's well described. I'm not sure if you look at what's happened in Scotland and Wales, where they have the authority to run the health service. I'm not sure that necessarily will work. And the trouble with a lot of these things, I've seen a lot of health sectors come and go, and they all come in with new ideas, and I'm not seeing any of them make any difference other than cost a lot of money in reorganization. And such a change would cost a lot in sort of reorganization. We don't know if it will work or not. Not if the basic structure, which is absolutely no control on demand and free at the point of use and abuse, not if that remains. And unless you do something to control the unreasonable demand on the health service, you're never going to solve this problem.
There have been big costs, obviously, the economy and to civil liberties. The economy can obviously, and it's showing signs that it's going to. Do you think the British people will ever recover the liberties that were taken for the pandemic?
I think
we've lost an awful lot.
I think it's hard. I think now that politicians have enjoyed the power of standing up at 5 o'clock in the evening and say, do this, do that. You see Nicola Sturgeon really enjoying her lunchtime briefings that she can rule over Scotland. And I think that the politicians have got to let go. They've got to see COVID as a one-off. They can't control our lives this way. I would much rather have people had been given individual choices, and they would have taken the right choices, most of them. And at the end of the day, we've seen now the numbers coming down, even though we're not in a lockdown. And I think people, by and large, have behaved sensibly. Even the nightclub opening doesn't appear to have pushed up cases just yet. So it'll be hard to get our liberties back, or the principle that we have the right to determine our own risks and our own fate.
Yeah. Again, Eamon Butley seems to be having a large pulling rank. He says, is the scientific advice pessimistic because the scientists get blamed if they underestimate what's going to happen? And scientists, they tend to like perfection. They tend to like everything to add up to all of the dots joined and so on. And has that made them pessimistic? Yeah.
Yes, but I think that's a cop-out. I think that's an easy way out. They're frightened they're going to be blamed. If they'd underestimated it, someone would have pointed the finger, so they overestimated. Look, when you go to a lawyer, of course they present the worst case scenario for your situation, but they also try to present a balanced view. That's the opinion you're paying for. And we need balanced opinions from the scientists, not worst case scenarios, so they can cover themselves when the public inquiry comes out. I think that's exactly what they've done. They've tried to give us the most pessimistic scenario and box the government in, because, okay, you are dealing with people's lives here, but we did need a little bit more in the way of objective advice.
How do you reckon Sweden, their approach was radically different? What's your verdict on the way they did it?
I think it was good. I think things like if a school child was sick, the child was sent home rather than sending home the whole class or the whole school. I think they avoided lockdowns as much as possible. The trouble is, I've been to Sweden. You can't really compare Sweden in terms of its demographics, its population, its density, its class structure. You can't really compare it with the UK. And that's one of the differences in the situation. The UK is very urban concentrations of high density people. We know poorer people do worse during the pandemic. We know ethnic minorities do worse. So comparing UK with Sweden is difficult and very unfair. I've never enjoy these inter-country comparisons for all sorts of reasons. The UK has its own issues and has dealt with them. But I think Sweden, by and large, took the right approach. I think certain states in America managed to stay open without devastating effects. Yeah, but if you look at the other countries, France, Germany, Australia, and New Zealand, I don't think they did particularly well. Australia at the moment of trying to achieve this zero COVID strategy by closing down when they get one case. It's a bit of a nonsense.
Yeah, Charlie Sherwood says the pandemic seems to have made the NHS even more of a national religion than it already was. Can anything be done about this? Well, yes.
That's the problem, isn't it? And people say, "Oh, the NHS has, has vaccinated me." Well, they have. I think Charlie's absolutely right. Whatever the issues were about the sanctification of the health service are now actually worse rather than better. I'm not here to criticise the health service for the sake of criticising. I just think we need to have an open discussion. And there are certain aspects of mainly access to care at general practice level and access to good quality hospital care without having to be very ill that need to be addressed. And I think we should focus, rather than criticising the whole of the health service, let's focus on the important things, or the things that we think we can change. And I think we should start with access in general practice and streamlining that in such a way that works, so we can use a combination of remote and face-to-face consultation in a way that works for everyone, rather than have a patchy system of protocol. And then look at what goes on in accident and emergency, because most doctors and nurses who work there will tell you that all day they're seeing people who are neither accidents nor emergencies. So I would try to focus on that aspect of it and leave them the other things like the more detailed specialist hospital care for the time being, because it's access to care that people have been most upset about.
Yeah, we've got a question from Derek May. He says, should individual citizen obligation to limit demand, perhaps by taking responsibility more for their own lives?
Well, that's my view exactly, although I've been accused when I say that of being a libertarian myself. Of course people should. I sometimes say, you might change your car every 10 years, but your body's going to last you 80 or 90 years. So look after it. And, those Americans who have to pay high insurance premiums, some of them take more care of their health than we do. We seem to think that we can smoke and drink and eat what we want, and the health service is going to pick up the pieces. But again, this is an ethical and moral discussion. It's about educating people. And at the end of the day, what we see in the way people use the health service is they say, me, put me first. And they don't have any sense of social responsibility to even use the health service appropriately. People make unreasonable demands on the health service. We haven't even strayed into that area. We just talked about demand without even separating that out into reasonable demands and unreasonable demand. I saw an email from a GP recently who's been criticised for not providing access. She said, I just thought I'd stay late and deal with one more email. And it was from a patient saying, I'm going to Thorpe Park. Can I have a letter from you to say I've got a back problem so I can jump the queue? And GPs will tell you that quite a lot of their work is of that nature. And a lot of people abuse the health service, and people are often just thrown to general practice to sort out certificates and so on and so forth. And it's unfair. But I agree with Derek. Of course, people should take their own responsibility for their own health, their own lives, and for the way they use the health service.
I saw an unfortunate aspect about the National Health Service, that because none of us has a choice to join it, we all have to pay for it, right? Yeah. You can't opt out of it and opt out of paying for it. And so anything we do that might involve risk or medical conditions has a cost to other members of society, the taxpayer. And so, having taken away our freedom to provide our own healthcare, it is now being used as an excuse to take away the rest of our freedoms. You must wear a helmet when you're cycling, because if you fall off, it's going to cost the taxpayers money. You can't go mountaineering because it's going to cost health service money if you have an accident. You must eat sugar or fatty foods, and so on and so on. And these people in public health in England, we were under attack daily for sugar taxes, bans on advertising, and so on and so on. All because everything we do with an NHS, externalities on the general public.
I never enjoy these calculations when they say that heart disease or cholesterol or diabetes is costing the country this or costing the NHS that. Because the reality is we all die, and we all die of something. And the anecdote I often say is that in the 50s and 60s, the government quite liked people smoking heavily because they all died at around 65, just when they were drawing their old age pension. It saved the government a lot of money. And the other thing is, most money is spent on us in the last 2 or 3 weeks of our lives. So these calculations about how much it costs the health service are a little bit banal, because one way or another, we all cost the health service money. And if you delay death from one reason, you're just going to die from another, and the care of the elderly is very expensive. So it's a slightly odd calculation. Having said that, I think people who cycle should wear helmets, not because the law says you must, but I think it's actually very dangerous, particularly in the big cities. And I see too many cycle injuries, and having gone to an old university where every year some parent was phoned up and told their son and daughter had been killed on a bicycle. So I think that's common sense, and there's common sense not to go to large indoor events at the moment unless you've had your 2 vaccines. And I don't think we need government to tell us that. I think we can make our own decisions.
What do you think about individual event organisers insisting on double vaccine certificates before they let people in?
I'm trying not to get into the culture war on certificates versus no certificates. My view on this is that everyone should have 2 vaccines. And if that means you can do more things, so be it. I mean, I just had to do some work in France. I've registered as a doctor in France. I had to have 5 PCR tests to go there and come back. I had to effectively have a vaccine passport. And I did that because I did that. And I think if people do want to go to indoor events, it's common sense for them to have 2 vaccines. Now, whether they have to provide a certificate, people, as I said, are getting very emotional on social media about the need for vaccine passports. I just think it makes sense to have 2 vaccines. I understand there are some people, for medical reasons, who cannot have 2 vaccines, but I am still meeting too many young people who are choosing not to have a vaccine simply because they've bought into some conspiracy theory or other about vaccines, which doesn't make sense.
Yeah, I keep going back to your butler, but he says, in this country, you can get a pizza quicker than an ambulance. Does that something about our country? Well, the answer is ambulance is public sector and a pizza is private sector. That would be my reply.
The chap delivering the pizza is on minimum wage and he's riding a scooter. He's not regulated. Salaries in the health service are very, very high. Healthcare staff are very expensive. The recent discussion about pay rise for healthcare workers, if you give the healthcare workers this 3% pay rise, that is a lot of money coming out of the budget. And it's what I call dead weight money, because from the day 1 to day 2, if you give the 3% rise, you haven't improved the service at all. You've just cost your service 3% more. I know that's an employer's way of looking at things, but it's certainly the way I have to look at running our clinics. And the comparison with pizza delivery, yes, of course, one is a commercial organisation, the other isn't. But in a sense, healthcare is an expensive commodity, and it's a complicated commodity, and ambulances and paramedics are expensive. And one of the things I'd like to try to train the public to do is to recognise that what they are asking for is very expensive all the time. And that's why it frustrates me when people say the health service is free, because that actually devalues it in their eyes, and it actually encourages misuse and abuse. I mean, I've always been anti-home visits, partly because I think the quality of consultation that I used to do as a home visiting doctor is always inferior to when I've got the equipment around me and I've got the time without having to worry about parking and so on. But anyway, that I digress. It's a good point, but I'm not sure it's a fair comparison.
Morgan Schondelmeyer asks, what do you think of the NHS health surcharge for illegal immigrants who are in fact taxpayers?
This is the whole. I don't want to get into the immigration debate is a difficult one. Every hospital will tell you stories of people that they think have come to this country who are not entitled to health service care, who get health service care and never pay for it. I personally don't have experience with that, but I've spoken to doctors who have. And the problem with that is if you have something that's free at the point of use, it is open to abuse. When it's one of the reasons I thought identity cards were actually a good idea when they were being talked about. It's again a moral issue. Some people put the pressure on the doctors. Doctors don't like having to challenge patients to say, what is your address? Are you a resident in this country? Are you legal or illegal? It's a difficult one. I think the health service needs to focus on ways to not spend as much money. Illegal immigrants paying tax, I'm not sure. It's a difficult moral and ethical dilemma, but overall, if you have a system that's free at the point of use, you are asking for it to be misused.
We've got a comment from Liam Cooper, who says that 3% increase, could be justified as aiming at retention of staff, which surely is something worth achieving. And if that's what to do it, then it becomes a worthwhile increase rather than a dead weight.
Yes. If 3% is enough, I think the problems at certain levels, certainly in general practice, where we've seen cohorts of people, baby boomer doctors retiring, a lot of doctors working part-time, it's hard to replace them. I'm not sure the pay rise will do anything other than keep us where we are. Of course, in theory, it should increase retention of staff, but the turnover of staff is a chronic problem for the NHS. How many people have you met in your life who are ex-nurses? All the time, because nursing it's about being a flight attendant. It appears to be a career you do for a few years and then move on to something else. And that's wrong. Nurses should be given a better career structure and pay structure. I do think health service workers need to be paid more, without a doubt, but we can't do that while so much money is being wasted in other directions. I would like to do that by raising money from the patients, by charging user fees. And someone has suggested, if you charge £5 to go and see a GP, that is an amount of money that most people can have access to. You have no exemptions. You don't see newspaper headlines of people dying because they couldn't find the £5. It would not only raise money for the health service, it would cut down a lot of misuse. It would focus people's minds. It would give them some idea that accessing healthcare needs to be charged for. And if someone had the strength and notion to bring that in, then I would love to give doctors, nurses, and the health service a pay rise. But at the moment, £212 billion, we're just pouring money into it and we're not improving it.
By the way, if there were a £5 charge for people who genuinely couldn't afford it, I imagine charities would step in immediately to make sure that they still had access, even though they lacked the ability to afford the fiver.
Yeah, I mean, the problem with all these things is once you start having exemptions, it's a bit like, as I said, the prescription exemption. Yeah. If you start exempting children, the elderly, people on benefits and so on, well, that's 60-70% of your population, and then it falls on the working low middle class as always. So I think if you're going to do something like that, it has to be with no exemptions. And you're right, presumably there may be access to vouchers or something through charities. But I actually think not just as a way of raising money, but a way of just controlling the demand. I sometimes say we have to pay for our food, we have to pay for our housing, we have to pay for our heating. These are just as essential to life as healthcare. I don't know why healthcare in this country carries this moral exemption that we mustn't pay for it.
Yeah, I've just been corrected. I'm told I got Morgan Trundlemeyer's question wrong, and she was asking about the NHS health service for legal tax paying, not illegal, legal tax paying. But I think we'll move on from that. I look forward a little bit after the pandemic. Are you an optimist or a pessimist?
Very much an optimist. Very much an optimist.
Do you think we'll come out of this?
Yes, without a doubt.
Back to normal or different?
Yes, the economy is going to pick up very quickly, and I think certainly, I don't know if the government will be able to repay their debt, and I think COVID will gradually disappear, and we'll just keep vaccinating, and it will disappear when it runs out of people to infect. Whether that's going to help the health service or not, I can't see that changing in my lifetime. But maybe we can start a conversation that younger people can take up at some stage, and maybe someone's going to be bold enough to make a big decision that helps the health service.
Now, I have to tell you now that your view does not sell newspapers. As you say, everything's going to be great. No one's interested. They want disaster stories. They want doom and gloom. I once had a book turned down because it was too optimistic and people only want to read about forthcoming disasters. So it's fine to have that book, but don't sell it to a newspaper or publisher.
I've not understood why some of the media, mainstream media, have enjoyed the negative aspect. Selling newspapers is one thing, but you see some of the broadcast media still buying into very negative stories every day, and I've never really understood why the journalists, let alone the people that own the channels, have enjoyed being so pessimistic.
I interviewed earlier this year Johan Norberg, and he came up with a very interesting notion that it's from our biological past that we are disaster averse, that the bad stuff matters more to us than the good stuff, because that's people who took that view survived preferentially and passed on that trait to their descendants. It's an interesting view, isn't it?
Yeah, it's the sort of chicken licking, isn't it? The sky's falling in. I've seen that comment. Yes, it's part of the human condition. You hear thunder rumbling when you're a caveman, you think the gods are angry with you. But we're always looking for nature's disaster. And I think climate change is something we should be focusing on now and moving away from COVID.
Very good. You made it clear early on you're an admirer of the Australian healthcare system.
Yeah.
Right. What are the features of it that you might take to heart and learn from?
As I understand it, it's a co-payment. So the patient pays a little bit, and either their insurance or I think the government pick up the rest. The doctor does charge an item of service fee, but this is very tightly controlled, so the doctors can't overcharge or make too much money. I think of all the health systems, and I hear this from Australian patients who are absolutely dumbfounded. A, when they have to come to me and pay our fees, which are much higher than they'd have to pay in Australia, and B, when they try to access a health service and find that they simply can't. I think the Australian system of all of them is probably the one worth looking at.
Have you had any personal experience of the Australians? You've obviously met patients who have.
I've never been to Australia. I've had experience of the French system, which is similar. It's co-payment, very cheap. You pay very little, and the insurance, the state essentially picks up the cost, and the doctor gets paid as an item of service fee, which I think is better all round. Yeah.
So it's insurance or state?
I think it's a bit of both. I think it's a.
Okay.
I think it's a. I'm not 100% sure. I think actually the state picks up quite a lot, as long as the patient pays a proportion of that.
If I propose that to a civil servant here, the first response would be insurance to be compulsory, because otherwise people who chose to spend money on wine, women and song and foreign holidays and got it, we'd have to pick up the treating them. So we'd have to make the insurance compulsory.
No.
Is it? Do you know if it's compulsory in Australia?
I don't know actually,
don't.
but what you have is you have a state insurance system, but it's a proper funded insurance system. It's not like our national insurance. You have, the money that goes in is the money that comes out. So you raise the money from the premiums. You could have a state,
ours is
hypothecated tax in a sense, a state-run insurance system that people have to subscribe to.
Ours is just, of course, a tax, like originally motor insurance is supposed to pay for roads, but of course it doesn't. It just goes into the general Treasury budget. And on that rather pessimistic note, I'm going to draw this to a close. And Dr. Girlis, thank you so much. That was very enlightening and very informative. And I thank you for taking the time to tell our viewers about that. And to our viewers, I will say, just to remind you all that we are not holding webinars in August, but we will be coming in September, and we'll be holding live person-to-person meetings in September. Now, there's something to look forward to. So I'll bid everybody a good night, and thank you again, Dr. Girlis.